have to be able to do it in a minute or less. So this week I had a very impactful meeting. I met with a colleague, David First. He's a professor in the Vanderbilt School of Business. He told me, if you can't communicate an idea in less than a minute, no one's still listening to you. Now, as a former business owner, I know that. It's your elevator pitch. But as a doctor, could that mantra be the tool that helps us improve our communication? Here, let me show you what I'm thinking. We're going to make a graph. On one side, we're going to look at time, and on the other, a patient's concerns. In an orthopedic visit, the concerns can include symptoms, fear of re-injury, confidence to return to sports in the case of athletes, and even the financial burden of the treatment. We believe that the amount of concerns a doctor can address is associated with the amount of time they're in the room. Let's call this 1 minute. Most doctors on average get about 5 to 7 minutes with the patient. They can address a few more concerns. I'm committed to addressing as many concerns as the patient has. But of course, as you can imagine, this type of approach used to take me 30 to 60 minutes with every new patient at my old practice. This can often flood a patient with too much information, and there is no insurance company that's going to pay for that. I know this because that's why I had to close my office. We often think that the relationship between these points is linear. And if we want to improve the amount of concerns we can address, we can work by training new medical trainees and residents to have better bedside manner, or teaching them to ask better questions. But as you can imagine, this small amount of change is sometimes difficult to experience for the patient. For me, it's too small and too insignificant. There's got to be a better way. That's why I want this. I want to be able to address as many concerns as possible in as little time. This type of jump takes a whole new approach to medicine. In fact, it might require us to use a whole different type of technology. And that's the reason why I'm endlessly talking about tools like patient-reported outcomes or wearable devices. I think they have the opportunity to bridge that gap. I'm just trying to figure out how to put this tool together. If you're interested in working with me, please reach out in the comments below. I'd love to get your input. All right, that's enough of sitting in the lounge. I gotta get back to work. Nope, still over a minute.